Hi, I'm Dr. John Shim, and today I'd like to talk about a rather boring topic, and that's the discussion about evidence-based medicine. To many, this seems like a buzzword or a way to justify certain treatments. In reality, evidence-based medicine is the more modern way to determine if clinical decisions are based on supporting scientific data instead of just pure tradition and medical art form. While I'd like to say that the current modern medical treatments are based on scientific data, the reality is many of the accepted practices are based on community standards. While they may be having some sound reason for doing these community standard treatments, unfortunately it's hard to know if these community standards are actually based on scientific data. Let's give an example. In reality, the use of antibiotics for many common respiratory conditions is probably counterproductive and may potentially cause more issues in the future. While bacterial infections can be eradicated by antibiotics, the right antibiotics must be chosen. If the infection is a viral one, antibiotics will not do anything to help that situation. The reality is antibiotics have been overutilized, and as a result, there are now many resistant strains of bacteria out in the community. These resistant strains are becoming more and more difficult to treat. Many now believe the common practice of treating common colds with antibiotics added to the development of these resistant strains. With evidence-based medicine analysis, we now know that 30% of all antibiotic prescriptions may not be necessary. With evidence-based medicine, up-to-date physicians will make recommendations based on the latest scientific data, not just based on tradition or trained learning learned years ago during their residency. Of course, the tension is the anxiousness of the person with the cold and also the confidence that person has in their doctor. If there's no confidence, usually that person will demand antibiotics, and it becomes easier to write that prescription than to take time as a physician to explain why the antibiotic will not likely work. And in a small percentage of time, the doctor is in an unfortunate "I told you so" situation, where a small percentage of colds do become bacterial infections. For people with neck and back pain, community standards can potentially lead to overutilization of many spine-related treatments and activities. Evidence-based medicine suggests that there's been a significant overutilization of tests like X-rays, MRIs, and CAT scans to determine the cause of neck and back pain. Yet, in our communities, there seems to be a demand that we get X-rays or CAT scans or MRIs almost immediately after these episodes of pain. For the vast majority of neck pain and back pain and sciatic nerve pain, the episodes usually resolve within 6 to 8 weeks. There are many examples of people getting very expensive and potentially risky tests and procedures for neck and back pain, but then their pain resolves even before finding out the results of the test. The evidence supports waiting and using common sense approaches like gentle stretches, over-the-counter medications, and activities modifications while waiting for improvement. As in the example of the cold, it takes time for the doctor to explain why the testing may not be necessary at the time of the appointment. Sometimes it's just easier to order the test. Also, in certain instances, there are incentives to order those tests. After all, the MRI machines and the diagnostic facilities do take funds to operate. In my opinion, evidence-based medicine has its role, and healthcare best practices do prevent unnecessary testing or procedures. Still, the role of the specialist is to determine when a person has a situation that falls outside the parameters of these best clinical pathways. In the end, evidence-based medicine does provide a good guide for common situations. If you're responding to the evidence-based medicine protocols, it works out for everyone. If you do not respond accordingly, then the expertise of an experienced doctor can help you step out of the protocols to help you find your diagnosis or solve your current medical condition. While I'm very supportive of evidence-based medicine, I also know the evidence has changed for many conditions. We all know that the recommendations for eggs, hypertension, things of that nature have changed over the years. Yet we have to go by the evidence. There remains a significant role for specialist doctors even in this era of evidence-based medicine artificial intelligence, and Dr. Google. I'm Dr. John Shim discussing evidence-based medicine. I hope you found this discussion interesting. Thank you.